Hello there. You look like you're looking for another reason to not get out of bed today. Well, I've got some wonderful news for you, because today we're talking about flail chest. Flail chest? So what is that? Why are you asking these questions? Why do you want to know these things? Why are you
asking me so many?
I think it might be better if I just show you. Flail chest, a traumatic injury to the chest. It's in the name, literally, flail chest. Maybe you got hit by a car. Maybe you're having a lovely day out on the swings, and then all of a sudden, So as you saw, I had a very traumatic fall. Now this is what it's going to look like on my chest as I'm breathing. Next, we're going to go to the lab to discuss what we just saw and how it affects us as respiratory therapists. Came to the park to show off my silly goose idea. Now I gotta walk back to the house, and oh my gosh, I also need to go back and pick up my camera. Welcome to the lab. Let's talk about flail chest, shall we? Ouch. Questions? Thank you for coming to my lesson. Flail chest is a result of double fractures of at least 3 or more adjacent ribs. No less than 3. Count them, 3. Now, have you ever done that thing where you like take your fingers like this and you like unfocus your eyes and you move your fingers in closer together? And after a little while, if you can get it just right, it kind of looks like there's a free floating finger in the middle without actually touching. That floating finger in this scenario is your rib. You have a double fracture rib that's free floating, and there's 3 of them in a row. And if you take in a breath, your chest is going to go in because you got free floating ribs, dog. It's going to hurt. It causes the thoracic cage to be unstable. It is a restrictive lung disease, life-threatening in severe cases, and fatal if left untreated. What are we restrictive to? That's right, yo mom. Volume, we're restricted to volume. So wait, it can be fatal? Well, yeah. Compromised ventilation, if left unchecked, leads to respiratory failure. You got hypoxemic respiratory failure and hypercapnic respiratory failure. In flail chest, you got those free-floating ribs, right? Well, you got the lungs underneath, and all of that trauma, all that damage can lead to what is called a contusion, or basically internal bruising, which can lead to fluid buildup, such as blood, for example, which will ultimately end up filling the alveoli, and you have no more gas exchange. You also have increased shunting, leading to a severe VQ mismatch, ventilation perfusion, for those of you who are curious, which leads to refractory hypoxemia. How do we fix refractory hypoxemia? That's right, yo mom. Pressure, we fix it with pressure. You may or may not be surprised to hear that this respiratory condition can lead to things such as tachycardia, tachypnea. Well, you can think of your cardiovascular system being under extreme stress in these situations, and if left untreated, it's basically a fast track to multi-organ failure. Oh no, I don't want to fail. What else can happen? Well, your patient can be fatigued. Think about it. They have a marathon worth of shallow, rapid breathing. Oh boy, my breathing certainly is rapid and shallow. Ow, it hurts to... I'm just gonna take a quick nap. Yeah, right here should be good. The things I do for you guys, they're not going to be oxygenating that well. Their body is going to get overly tired and overly exerted. Along with the shallow breathing comes the inability to cough, which means the inability to clear secretions, which leads to a buildup of secretions, which could lead to a secondary pneumonia. And if left untreated, that can turn into sepsis. Good thing we're here to help. We can expect to see rib instability, lung volume restriction. We are restricted to volume. That's right. Yay! Atelectasis, those poor air sacs are going to be devastated, my guy. You even have the possibility of getting a pneumothorax? What? Well, yeah, that free-floating rib is sharp, and you got a little lung underneath that. This poor little lung is made of very soft tissue. What's going to happen to the soft tissue when that hard, dense bone that is sharp and jagged pokes it? Like I said, you could expect tachycardia, tachypnea, hypoxemia, which can lead to an increase in blood pressure. Your heart doesn't know what's happening. All it knows is that it's not getting the proper oxygen, and so it's going to say, oh, all right, bet. And it's going to start squeezing faster and faster and faster. Well, it's also going to say, hey, maybe we're not getting the right perfusion that we need, so it's going to increase that pressure to try to compensate for that loss. Now, during auscultation, you can expect diminished breath sounds. But think about it, my guy, you're going to be in a lot of pain. You're not going to want to take in deep breaths, so of course you're going to have diminished breath sounds. Paradoxical chest movement. Cyanosis. You're going to have an increase in CO2. Well, yes, but why? Well, that affected side, that lung, that is caved, that side of the lung that's caved in, let's say it's my right side, my right lung is going to be collapsed, it's going to be restricted. So every time I take in a breath, my chest is going to be pushing inwards. All of the available gas that's in my right lung is going to shunt or push over to the left, and it's going to fill up the left lung. And whenever I exhale, the air that is in my left lung is going to go back and refill this air. So I'm not properly ventilating, I'm just moving a bunch of dead space or dead air back and forth. Because of that back and forth movement, I'm not ventilating properly, which means I'm going to have a buildup of CO2. Hypercarbia, hypercapnia. Why can we never agree on what to call things? A decreased ventilation to perfusion ratio and a decrease in PaO2, the partial pressure of arterial oxygen, or the oxygen that is dissolved in the arterial blood. Every time you breathe in, the lung is compressed and gas will move into the unaffected side. With expiration, gas moves from the unaffected side into the affected lung. That movement of air is called penduloft movement. Say it with me now. Penduloft. You're going to have increased opacities around the affected lung due to the compression of the lung and also atelectasis, and you're going to have rib fractures. So in a mild to moderate case of flail chest, you're likely to see a respiratory alkalosis, and in a severe case, you're likely to see a respiratory acidosis, decrease in lung compliance, activation of a bunch of different receptors, your deflation receptors, your irritant receptors, your J receptors. And then it goes without saying, you're going to have pain. Because of that pain, you're not going to want to take in a deep breath. So what can we do? PEEP. Positive and expiratory pressure. Commonly used to stabilize a flail chest. Generally, 5 to 10 days of mechanical ventilation is adequate for sufficient bone healing. This is where we come in, my dudes. Oxygen therapy. We want to work on airway clearance because they're not going to be able to mobilize secretions that well on their own. And lung expansion therapy. Pop quiz. When would you choose CPAP versus BiPAP, or BiPAP versus CPAP? And yes, even invasive mechanical ventilation is an option. If they meet any of this criteria, these are parameters I pulled literally straight from chapter 11 of this book. I promise I'm not as smart as I look. Ow. Final tips and takeaways. Don't get flail chest. Don't get in a wreck. Things can happen that are out of our control. Don't leave the house. Maybe just don't get out of bed. Thanks for coming to my presentation on flail chest. Lastly, I would like to leave you with a song that I wrote.
Some ribs fell apart, now my achy breaky heart gotta pump super fast, cause this oxygen won't last. Need some beat and some time, airway clearance on the side. Gotta vent, cause I'm spent, hope this crazy pain subsides. Flail chest, fail the test, now your chest is on the move. In and out, when in doubt, stabilize with PEEP and boogie to the screw. Time we boogie. Flail chest, flail chest, flail chest, paradoxical, flail chest, paradoxical, flail chest, paradoxical, flail chest, paradoxical, flail chest.
In other words, you can tell it's a flail chest by the way that it is. Any questions? Oh brother, this guy stinks!